More than just pale skin and tiredness, did you know or do you know the symptoms of iron deficiency anemia in kids? Now, tell me, if you do have a child who has had iron deficiency, tell us what were the signs and symptoms? Please comment below. Now, Deb and I are talking today all about iron deficiency in kids. So, everything from the signs and symptoms to what can you try and do to prevent it and who's at risk. So a little introduction for those of you who haven't met us before. My name is Sarah Hunstead. I'm a paediatric nurse, mum of two, and founder of CPR Kids. And as usual on Mother Doctor Nurse, I am joined by the fabulous paediatrician, Dr. Deb Levy, who is also a mum of two and is here to just simply bust all of those Google myths and really help us get to the right and good evidence-based information. So thank you for joining us. We are coming to you from Gadigal and Bidjigal land today. We would love to know where you are from. And remember, Deb would love to answer all of your questions. So type them in the comments below. Remember, we can't give specific medical advice, but first thing I'd like to know, Deb, is how are you coping with the crazy wind that we've got here going in Sydney at the
I
moment?
know. I know, like my hair is like kind of everywhere. And I don't even want to look in my backyard because we've got this most beautiful tree, but it just sheds leaves and now it's just like covered.
Yeah, I know. I know. And do you know what it's like having kids in this wind? Kids go crazy. All school teachers hate
Kids
windy
and
days.
dogs. Yeah.
Yes, I know, they all go nuts. So,
Mm.
what I would love to start with, Deb, is can you tell us? So, obviously, we have iron in our bodies, but what does it do? Why is it there?
Look, the most important function of iron is actually that it carries oxygen around the blood. So it's part of the red blood cells that travel around, deliver oxygen, which is used for energy consumption. So that's what it does. Really, really important.
Yeah, perfect. So, well, now we know what iron does in the body. What is iron deficiency? Like, what does it mean if we don't have enough iron in our blood, or especially for our kids?
Yeah. Well, there's a grade of iron deficiency. So you can go from mild all the way to severe. So,
Mm,
you know, the majority of young children that I see are actually iron deficient.
mhm,
And often it's not severe. So let me just jump into, well, what is severe iron deficiency?
mhm.
So
Yeah.
severe iron deficiency is when iron is so low that your children actually become anemic. A lot of
Right.
pregnant mums out there may have experienced
Mhm,
this themselves, and they may be going, yep, I know that. I know how I felt, and I know what treatment I needed.
mhm,
Well, exactly the same can happen to our children. So that's
mhm,
on the most severe side. On the mild side, it's just iron levels, and we can talk about this if you want, Sarah, that
mhm.
are just below what is a level sufficient enough for our children to function optimally. If that's one way
Mhm.
to put it.
Yeah, that's actually a really, really good way of putting it. So, tell me, how is it diagnosed? How do you know if your child is deficient?
Well, firstly, it's a whole collection of what. Let me actually take it back. Um, Initially, it's on looking at potential risk factors. So, which children are more likely to develop iron deficiency? It's
Mhm,
then looking at children's symptoms, their state of health, their energy levels, sleep, etc., as well
mhm,
as their diet. So,
mhm,
that should always be a part of any medical assessment. Your child
mhm,
history around their diet. And then finally, it's a blood test. There's no
mhm.
way of escaping that blood test if
Yeah.
your doctor suspects it.
Mhm.
Because personally, I don't feel that I can either safely as well as accurately treat iron deficiency without knowing the exact levels.
Yeah, especially if you're saying that, there's that mild and moderate and severe, you need to
Mm.
know on what scale that is, I guess, to be able to do that. So, you just talked a little bit about kids who are at risk. So who is at risk?
hmm So I guess it depends what age we're talking about. So
Mhm.
let's start with the younger babies. Babies whose mums were iron deficient during pregnancy and
Right.
during breastfeeding. So they're
Mhm.
definitely at risk because that's how babies get their iron through mums.
Okay.
Then babies who are born premature, babies who are exclusively breastfed, especially as they hit that 6 month mark.
Mhm.
Round about that time is when their iron stores often will dip down. And then it's
Right.
babies who don't have enough iron, babies and children who don't have enough iron in their diet. So,
Mhm.
or are losing iron. So I think, if you want to look at it, I feel like I'm listing a whole lot of things and I never like to overwhelm. But I think if you look at it in three main groups, one, they're not getting enough iron, whether
Mhm.
that's from mum, from breast milk, or from food sources.
Mhm.
Two, they are using a lot of iron, and that could be a child with a chronic illness,
Mhm.
or maybe they're just going through growth spurts. Or
Mhm.
three, a child who's losing iron. So that's typically the most common way to lose iron would
Yeah.
be through bleeding, which
Right.
I must just put out there is very unusual. The
Yeah.
other way of losing iron is actually that you're not absorbing it properly. Again, unusual, but something that we
Mhm.
have to consider if children aren't responding to treatment for iron deficiency.
Okay, excellent. Now, I want to talk about iron rich or iron containing foods a little bit later, but what I would love you to answer now for everyone, because this is, I think, why everybody's sitting here just going, come on, Deb, this is what I really want to know. What are the signs and symptoms that, as parents and carers, that we need to look out for that may show that we need to take our kids to the doctor to be investigated for
Mm-hmm,
this?
mm-hmm. They can be a little bit atypical and quite varied.
Mm.
For us as adults, often when we're iron deficient, we just feel exhausted, and we just want to sleep all the time, and we've got no energy.
Yes.
you know, but funnily enough, with children, it can be the opposite. So they can get hyperactive, their sleep
Really?
can be interrupted, yeah, and
Okay,
their behavior
so
can
stop,
change.
stop for a sec. Sleep can be interrupted.
Yeah,
Wow.
yeah.
Okay.
When I see children in my rooms who aren't sleeping properly, I will always explore the idea whether or not there's iron deficiency, and
Yeah.
certainly the pediatric sleep physicians. So those are pediatricians who've specialized in sleep in children. They do like very generous iron levels in the body.
Wow. Okay. Sorry to
Mm,
interrupt, but I think that's one thing that a lot of
mm,
parents will be going, whoa, I really didn't know that.
yeah,
Yeah.
yeah.
Please keep going.
Gosh, I don't know where I was, Sarah.
Oh, you're up to
What was
sleep.
I talking about?
Sorry.
No, that's okay. I think, I mean, look, unless children become anemic and then they can become, then their energy levels will drop. They may have trouble with their breathing. I mean, but, that's really on the extreme end, and we seldom will see that.
Yeah. And I
Oh,
mean,
sorry. The
usually
other thing I was going to mention, sorry, I did forget to say,
that's right.
is that it can actually make children become fussy eaters as well. So it can be
Right.
caused by fussy eating, and it can like become like a bit of a vicious cycle with that.
Mhm. Yep. Okay. Excellent. Now, this may be on the severe end, but certainly, reading a bit about iron deficiency, a lot of the good websites out there, they also talk about I think I might say this wrong, but pica, where children may eat unusual things as well. Is that something that you've ever seen, or is that really for the severe end of the scale?
Um, I've certainly seen it. Often they
Wow.
are a bit more on the severe end, but it can happen at any stage. And yes, you're correct. It's the craving of non-food stuffs.
Mhm. Okay. Is there anything that's common with that, or is it just random? What have you seen before?
Well, it's often dirt and it's often ice. I mean, that's what I've seen in patients, but it can be random things.
Yep, extraordinary. Okay, fantastic. So we know the signs and symptoms to look out for. We've talked about who's at risk, but what can you do? Is there anything that you can do to actually prevent this? And if your child has been diagnosed with iron deficiency, what do you need to do? What's a treatment?
Mm. Um, So what can you do to prevent it? So,
Mhm.
the majority of children develop iron deficiency because of, remember I said to you that the three causes: not getting enough, using too much, or losing too much. So the majority of children will be not getting enough. So that's around addressing their diet. For
Yep.
exclusively breastfed babies, that means the early introduction of iron-rich foods. For older children, that means boosting their iron-rich foods in their
Mhm.
diet. Just
Yep.
being aware that calcium-rich foods will decrease absorption of iron, so don't give a steak with a glass of milk.
Okay.
And vitamin C foods will increase the risk of iron. So rather give it with a small little, splash of orange juice or something like that.
Okay.
The other way to prevent it is, I would say, is just being aware of it, being aware of how much your child should be having and any of those possible symptoms. Then the treatment part is, it depends on how severe it is. Sometimes it can just be treated with diet, and other times children need medication. Very, very rarely they'll need either, intravenous iron. Very rarely. I've never personally done it in a child. And even more rarely needing a blood transfusion. That is really on the extreme end. So I just want to say the majority, by far, of children that I see will have oral replacement of iron. So in other words, medication.
Okay,
and
excellent.
I can talk more about that too.
Yeah, that'd be great. And you've mentioned iron-rich foods a few times. So of course, the first place my brain goes to is, everybody thinks of a steak first up. But what other foods are there that you recommend for kids that to boost their iron?
I'm looking down because I am just seeing when I last posted on my Instagram. So please head to my Instagram. There's my handle there. But I should have some posts here with infographics of exactly what iron-rich foods are, both meat-based as well as other. Of course, I can't find it now, but sorry about that. So look, I mean, there are two main groups of iron-rich foods. One is your animal products and one is your non-animal products. So your animal products, obviously some people prefer to avoid animal products, and that's fine. But they do have the most bioavailable iron source. So yes, that actual food may not be as rich in iron, but the iron that's there is easier to absorb. So my favorite for children is, and don't gag, liver. So I will often recommend to my patients, yes, put them on some liver, whether it's liver pate, having sneaky bolognese. In other words, when you make your bolognese, add some liver in there. Freezing cooked liver and then grating it onto food. I mean, there's a whole way of boosting iron in a child's diet without them rejecting it too much. So definitely there's that whole group of foods. And then you've got your group of foods, which are your non-animal sources. So the other iron-rich food that I do like is egg yolk. I do like egg yolk in children other than meats. And non-iron-rich foods, your legumes, your green leafies, a lot of foods have some iron in it. Just be aware that you will often need bigger volume.
Okay, so non-animal iron.
So yeah, and if I can't find it on my Instagram, I'll post something later, so you can just save that as a cheat sheet.
Okay, excellent. Thank you very much, Deb. What else would you like to talk about? You said that you wanted to go into treatment just a little bit more. Is there anything else that you'd like to chat about? And remember, everybody out there, if you've got any questions, now is the time to ask them. Please post them in the comments below.
Look, I think what is important to know is what to expect if your child is diagnosed with iron deficiency. So if your doctor diagnoses your child and decides to treat them, there's several options in how they can treat. What I mean by that is there's several different iron formulas. I will often get asked, is the iron in my child's multivitamin enough? And the answer is no. If a child is deficient, it's not going to be enough, because usually that sits around about 2.5, sometimes 5 milligrams of elemental iron. And often I'm putting children on 50 milligrams of elemental iron. So again, you've got to be very careful. Never self-prescribe high doses. That can be dangerous, but it's not unusual. That's what your doctor recommends. So they're different formulas with different side effect profiles. Generally speaking, though, they will all make your child's poo black. So do not get a fright if that happens. They can also be a bit stickier than normal, so hard to wipe. Some formulas will cause constipation, so be aware of that. And you can try other ones that are less likely. The other one is if your child is on the syrup form, which obviously most young children will be, versus a tablet, is that syrup can actually discolor their teeth. And the way around that is, what I always say is, put it next to the toothbrush. You'll remember to take it, and that means you're brushing your teeth after, so you won't get that discoloration. Iron therapy is often for a chunk of time. Typically, that would be a 3-month period, and then your doctor may or may not want to test afterwards, just to make sure those levels have come up.
Excellent. Fantastic. Now we do have a couple of questions. The first one here is Jessie, and what she has said is that she's found that her child has teeth grinding and restless leg too. Is that something that you've seen as one of the symptoms?
Certainly restless leg. I mean, teeth grinding is one of those funny symptoms where so many things are attributed to it, but it's really hard to prove exactly what it's from. But definitely restless legs. I think my brain went on a bit of a fritz when I was going through, through all the symptoms. The other thing that iron deficiency is associated with is night terrors, nightmares, sleep talking, all those parasomnias, as well as breath holding is another one. So there actually are more symptoms. Sorry, I think I just, as I said, I had a bit of a brain freeze.
No, all good, Deb. No problem at all.
Thanks, Jessie, for reminding me.
And also Danielle has asked, is there a connection between iron deficiency and itchy skin without a rash?
I really don't know the answer to that. What always pops into my mind with itchy skin without a rash is I want to know what that child's liver function and kidney function are. But I'm not certain on that. I would have to hit the literature on that one. Sorry, I can't answer your question.
No, all good.
I've not seen it. Let's just put it that way.
Yeah, no, perfect.
Yeah, and I've seen lots of iron deficiency. So if it is, it's not common.
Yes. Now, so Jessie has also said her son's saturation level is very low and ferritin is 36. Does this mean that somebody is not absorbing iron? So as Deb said, we can't give specific medical advice, but, is this generally, is there something you can generally answer about this, Deb?
Okay, I think that what Jessie's brought up is how to interpret iron results, and I think it's important to know because sometimes only a ferritin is done. So what's ferritin? Ferritin represents the iron stores in a child's body as well as an adult. Obviously, everything I'm saying is kind of, you can kind of talk about adults too, but so ferritin just looks at the iron stores, and that typically is what is if only one test is done, that's usually what's done. And I'll explain why I think this is a problem in a second. The other thing to look at are the saturation levels of the cells and then the free iron floating around in the blood. So those are the three parameters that I always look at and I always go through with families. The reason being is that ferritin is also what's called an acute phase reactant. What's that and why do I need to know? It's one of those funny things that will get falsely elevated when your child is unwell, and unwell with anything like a snotty nose. So it's part of your body responding to an infection, which is why it can be difficult to interpret when your child is unwell, which is why we need all of the parameters. So I guess, that is part of how I'm going to answer that question is what is that actually going on with your child and what are those real ferritin levels? And the way to determine what's real is to make sure those bloods are done when your child is well. The other thing to comment about is if your child isn't responding to decent levels of iron therapy and whether, that's, 8 mils, was it 8 mils initial?
I'll bring
10
that up
mils, whatever. Like that. Those are general, those are big doses. First of all, I've never given a child 30 mils. That would be 300 milligrams of iron. And I think that's unsafe. So I'm going to say that outright. But, generous doses and still not responding, to me, this is a child that should be further investigated. So I would definitely go down that path of whether it's speaking to a gastroenterologist or someone else. So I think that's what I would normally do in my practice. Does that answer your question?
I think so. I think Jessie will let us know. But I think, it's time for investigating for other things and not as simple as just, very good. So if you're not seeing a pediatrician already, time for a pediatrician who may refer you on to some specialists. Yeah, fantastic. Very good. Okay, that seems to be it for all of the questions today. And remember, we can only answer questions while we are live. But next week, we are going to have our final Mother Doctor Nurse for the year. And what we want from you are questions.
Not next week, the following week.
No, the following week. Yes, my mistake. I always get
Sorry,
the
I
dates.
can't make next week.
That's right. No, I am. Yeah. Oh, goodness. I am so bad with this.
It's the end of the year. All of our brains go a bit, woo.
I know. Well, we'll be back, not next week, the week after, but what we want is we're going to do the whole session on your questions. So you need to submit those to us. So put it through our DMs on either Facebook, YouTube. You can put in the comments on YouTube or on Instagram as well. And we will be answering your questions. Remember, we can't give specific medical advice, but anything along the lines of pediatric health and first aid, we are going to answer your questions. So, hang on, we do have one more question before we go off. I'm not sure if it's a question. Let me read it. Thanks, Sarah and Deb. Do you have any info of the cognitive impacts of iron deficiency in children? Okay, there we go.
Yeah, well, we do know that iron deficiency impacts learning. So in terms of IQ points, I can't give you that kind of data, but we know that it impacts concentration, attention, and learning. So always important for children, for example, who are being diagnosed with ADHD. It's important to check their iron levels and optimize those. You know, learning difficulties, learning disorders. It's always important to optimize their iron. And children who like to eat frozen fruit, I'm guessing it's the same as ice. It's a form of pica.
Yep. Okay.
Or pica, depends what country you're from, whatever you want to call it.
Right, there you go. Excellent. Thank you, Deb, and thank you, Lauren, for your question. Okay, well, we will sign off. We will see you not next week, but the week after. Please let us know your questions because we love being able to answer that. And thanks for joining us today. See you later, everyone.